Hi, my name is Gretchen Jimenez. I'm a student physical therapist. Today I'm going to be performing some special tests for a right infraspinatus tendinopathy with underlying multidirectional instability in T2 to T4 right extension hypermobility. So I'm going to start first testing for a tear of infraspinatus on the right side. And so I would take the patient's arm into external rotation passively, and I would to let the patient know, go ahead and hold this here. And a positive would be if she were to drop her arm down. Next is I'm going to do the special test looking at an infraspinatus tendinopathy. So again, I'm going to have the patient hold their arm here at the side, and I would say, don't let me move you. Good. And a positive would be pain and or weakness. Next, we're going to be testing for a palpation of the infraspinatus tendon. So I would take the patient's arm at about 60 degrees of flexion, adduction, and external rotation. And I would say, don't let me push you. And then I would feel the infraspinatus tendon popping out, and then I would just go ahead and do some little transverse friction. And I would ask the patient if she felt any tenderness there in that area. Next is we're going to be doing the sulcus special test. I'm going to go ahead and pull the patient's humerus down, and I'm looking for a depression below the acromion, also called a sulcus. And so you would start with the non-involved side first, and then you would go to the involved side. Same thing, you're going to pull the patient's arm down, and you can either see or feel for the sulcus, and it would be a positive on this side. For multidirectional instability, same thing here. We're going to do another special test called the load and shift. You're going to take your hands and you're going to press the humeral head into the glenoid, push posteriorly and anteriorly, starting with the non-involved side. Again, then you're going to move to the involved side, push in anteriorly and posteriorly. And she would have a hypermobility anteriorly and posteriorly, showing that she does have multidirectional instability. And then for the last test, I'm going to have you go ahead and lay on your stomach for me. And we are going to perform some PAs of the thoracic spine. So I'm going to go ahead and start at T1, pressing on her chest bone. And then once I find T1, we're going to go ahead and perform a central PA first of T1, which would be normal. And then I would do a right unilateral PA and a left, which again would be normal. Then I would find the T2 spinous process, pushing again on the laminas downwards. This would be hypomobile. Pushing down on the right, this would be hypomobile as well. And then moving to the left, that would be a that one would actually be normal. Moving to T3 spinous process and then onto the laminas. We're going to go ahead and push downward again. That would be hypomobile. When you move to the right, that would be hypomobile as well. And then this one would be normal. Going to the T4 spinous process, moving around to the laminas. Central PA would be hypomobile. A right unilateral PA would be hypomobile, and the left would be normal. And then moving to T5, central PA would be normal. Right unilateral PA would be normal, and then the left unilateral PA would also be normal. And that concludes all my special tests.